And tonight our speaker is the fantastic Ruth Devlin. She is really, really amazing. And she's also written a fantastic book called Men Let's Talk Menopause. And I'm sure that she will be covering tonight what she has researched and found out that men want and need to know. And she's also going to throw in some other goodies to help us along our way as well. So without further ado, I'll pass you on to Ruth, who will no doubt explain more about who she is and what she's going to be doing. So,
okay. Hi, everybody. Just as I come on, my screen goes a bit funny, but there we go. We'll just sugar it around a bit. Hang on a moment. There we are. Very nice to see you all. Absolutely wonderful to see all those faces. Absolutely fantastic. So we decided that I would talk a bit about, you know, what men need and also want to know, having written my book, Men Let's Talk Menopause. And then I'm going to cover a few basics, and which obviously all women will find interesting and useful as well. And then maybe give a little basic insight into the benefits of CBT as well. So first of all, we're going to tackle men. And I can see a couple of men there, which is great. That's wonderful. You're attending. Get all your partners in. Hello. That's marvellous. So first of all, I just want to say I'm obviously not a man, and these are obviously general views, and I wouldn't presume to know exactly, you know, I'm not being a man, what everyone thinks. The same as no one knows what every woman thinks or feels or experiences. But I have spoken to an awful lot of men over the last few years, and given many talks to men-only sessions. So I do have a wee inkling. Likewise, I'd just like to say that also before writing my book, again, I didn't presume that you know, that men actually wanted a book on this. So I set about sending off a questionnaire, quite a detailed questionnaire, to lots of male friends and relations and work colleagues, or from all different walks of life, who I knew if they actually bothered to reply would be extremely honest and blunt. So what surprised me the most when I got those replies was that, you know, 90% of the men actually replied. You know, shame on you, that 1%, but 99% of people actually replied. And then also the other thing that surprised me was the speed that they replied, and then the quality of their answers. So some were predictable, but many were very enlightening and insightful. And without question, they all said that they wanted more information. And some of them said, you know, don't make it too long. We just want to have the facts. We don't want any fluffy bits. And can we have a few hyperlinks, please, as well? So that's what I set about doing. And it's a very small book. It's a very little handbook, and you can whiz through it in about an hour and dip in and out of it. So I am aware that when I'm talking, I do tend to move around a bit and flap my hands, and I don't want to give you all motion sickness. So I'm going to turn my camera off just for now before I share the slides, but I will turn it on again when we have questions at the end. But do ask questions as we're going along. I really don't mind. And if Elizabeth or anybody Claire, you want to interject, then just shout away. I'm quite happy for that to happen. Okay, all right. So what men need and want to know about the menopause, the basics and tools to cope. And very much this is going to be taking a balanced approach to rebalancing hormones. I'm really strongly think that, you know, you really do have to take that balanced approach, that everybody's given every different option available to help cope with symptoms, and that one particular thing isn't pushed in people's directions. I think that is a really important thing to think about. So another thing is that, you know, when I go and do talks in organizations for men only, I would just like to say, you know, I'm always surprised, and I shouldn't be surprised, but they are all really well attended and all really interactive. So that's a good positive thing to take away today. Okay, so let's get going. So what do they want to know? And for those more observant of you out there, you've got an image of Jeremy Clarkson on there. I mean, some people will love him and some people will find him extremely irritating. But I've popped that photograph on there because, well, obviously he's a man. But when I was thinking about writing my book, my husband, who's a bit of a carnot and finds Jeremy and his fellow presenters rather amusing, you know, brought to my attention that he'd actually written an article on his views on the menopause, and also on men's midlife crisis as well. And as he's a rather good writer and he's also very amusing, he gets right to the heart of the matter. And it is really good article. It was written in the Times in 2017, if anybody wants to look it up. It's still online. But he then graciously concluded that, and I quote, that he ended up saying he respected that we all as men need to respect the menopause. So good on him for writing that. But then, I had to have an image on a man there somewhere. So I thought, well, why not put him on? So what do men want to know? And what essentially do you want them to know as women? Well, basically, they need to know anything that women want to know. That's the most important thing to get across. Don't withhold information from them at all. Like they want to know what are the symptoms. There's over 34 different symptoms. You have to, they want to know why is it all happening. And, it's really good to explain to them, we've got estrogen receptors all over our body, which is why we're experiencing so many different symptoms and why, estrogen plays a role in lots of different body functions. They're confused as to why there are so many symptoms and why they don't have a similar experience as a man. So a little bit of explaining there goes a long way. How do you cope with them or treat them? We'll go into that a little bit later. But really, really important point is that, you do find out all those different options available to treat, not just the medical options, the lifestyle options, alternative options available, and then you can make a more informed and educated decision as to which route you want to go down, which is really, really important. And then, one of the main things they want to know is she going to return to her old self sometime in the near future? That is one of the most commonest questions that I get asked. And everybody obviously is having a very different experience with their partner or their wives. And I think it's good sometimes as women to take a little moment and to realize that, it can be a little bit disconcerting, can't it, sometimes? And some will say a little bit scary as partners and wives morph into maybe somebody, that in extreme cases that they don't seem to recognize for part of the year. And I think everybody is very different, but that can have a real knock-on effect on relationships. And so it can't be underestimated how much your symptoms can be playing a role on relationships and how they're feeling as well. And then how can they help? Yep, they can help, but this can be a hard one because, again, you give them all this information and then you don't want them to go home armed with lots of leaflets and websites brimming with information, and then trying to tell their partners exactly what they ought to be doing and how they must be feeling when really they don't have a clue. So I would say to any men listening, err on the side of caution, get lots of information on board, but don't do, please, what one of my friend's husbands did, and he went to one of these talks and he got very well educated about all sorts of different things, and he really honed in on the education around the pelvic floor, and thought, right, okay, yeah, I've got to, just told some organization, it wasn't myself, that every woman needs to do their pelvic floors once a day, at least 3 times a day. And a good idea is to set reminders for them. So a good idea is to put sticky labels on things where they're going to come across, like the kettle and the teapot and whatever. So my poor friend came down the next morning to lots of sticky labels all over teapots and kettles and toasters and pans, which immediately got ripped. And that sort of thing is going to obviously really start to annoy them. So just a little err on the side of caution, guys. So this slide doesn't have much on it at all, but it's a really important point that I want to make here. So from experience, they want all this information because certain symptoms can affect them too, and they want to help, but please don't treat them with kid gloves. And by that I mean give them all the information. And so as an example, I'll give you one organisation who I'd done several talks for. They'd just had women-only talks. They'd tried to get mixed talks going, but only 1 or 2 token men had turned up. And so they decided to do a men-only talk. And you'll find that, just to veer off slightly, is that a lot of men in organisations, if I go out into, I don't know, well, when we could go out and do face-to-face talks, even online as well, a lot of men will be sensitive to the fact that they realise that women don't want to talk about intimate details with men around. So they make that decision not to come on a call when actually they're desperate for the information. So, you know, that's where we started doing men only talks, and they have been really successful and well attended. But, you know, one organisation who had done these lots of talks for, and so knowing my enthusiasm to get across lots of information about the genitourinary symptoms, so anything to do with the vaginal symptoms and urinary symptoms, they suggested that maybe I left that section out. But anybody who knows me well, you can imagine my reply to that, and absolutely not, no. So these are the very symptoms which are going to affect relationships, have an impact on sexual intercourse and intimate relationships, and can have a huge impact on women. So my advice to anybody is absolutely give them everything. Don't treat them with kid gloves, because they're big boys and they can handle it. Okay, so yeah, do give them every information that you can. And also, just out of interest, the amount of men I come across who don't know that they've got a pelvic floor as well. Really interesting. So, you know, if you are a man listening out there and you don't know, you do have a pelvic floor, you do need to strengthen that pelvic floor and do your exercises just as much as women, and that will help you later in life. And both men and women, if you have a toned pelvic floor, you're going to have better orgasms. So that is a really plus point, isn't it, to go home and take. But if you don't know how to do your pelvic floor, one thing to recommend is to download the Squeezy app. I'm going to put that on the resources at the end. Claire and Elizabeth will know very well about this app. It's an app which is founded by a physiotherapist who specialises in women's health, and it's brilliant. It gives you timed exercises, gives you reminders for exercises, tells you everything you need to know about a pelvic floor for men and women. Absolutely download it and get exercising. I do hope you're all trying to do your pelvic floor exercise right now. I can't see most of you, can't see any eyebrows going up, but if you don't know how to do it, download that app. It'll be the best $2.99 that you spend. Okay, so the most common question that I get asked, especially if I do talks within the workplace, is how on earth do I broach the topic, or do I bring up the topic, or how do I actually say the word menopause to somebody? And obviously all this advice I'm giving, one size does not fit all, plus every woman is going to react differently. And I think some women have, you know, a really negative response just to the word menopause. And there's a fantastic quote by the Indian Menopause Society, which is in menopause, we're not aging, we're ripening to perfection. Isn't that wonderful? And I think that gives such a positive slant on this transitional period. And I think if we can see it more as a transitional period rather as something to be feared or not talked about, and lots of women, they do bury their heads about this stage in their lives. They don't think that, you know, they're old enough to be experiencing the menopause. They don't like to think that some of the symptoms they're experiencing are aligned to the menopause. You know, a lot of women very much think that it's for little grey-haired grannies tottering around on Zimmer frames, and they don't think that, you know, it could possibly be happening to them in their early 40s. And I think that's a really important point to get across, that it can happen at any age, unfortunately, you know, but how to actually get across the topic without mentioning the word menopause is a really tricky one. So within the workplace, especially if you're a manager, if you're a male manager and you are trying to support lots of female staff, especially through this transitional stage, then do make sure you're up to speed with the basics. You know, just basic information. You don't have to be an expert, you know, not expect to be an expert on all sorts of women's health. And there are very few experts around there. But it's very important to make sure that you are available to talk, that you're happy to open the conversation, that you are there to communicate. That is really, really, really important. Communication is key. And that, well, by that I don't mean that you have to sit there and go through all the symptoms, all the ways to cope with the symptoms. Just be there and know that, let people know that you're acknowledging the menopause as a significant health condition for women. That's a women's issue. And I think, again, some male managers can get very overwhelmed by the sheer amount of women's issues there are out there, and they think, crikey, we've got to talk about menopause now. But make sure that you've got menopause policies in place, and be able to provide that support and provide resources and signposting, even if it's referral within an organisation to occupational health or whatever, somebody else who maybe is a key figure within your organisation, who's a female, who somebody might be more happy talking to. Just make sure that you open that communication. And as a suggestion, a subtle approach. Instead of thinking of that one-liner or blurting out something which can come across a little bit insensitive, think about more about how you can share the information, and then think about maybe another way of phrasing things as to how you could ask that question. Maybe think, is there anything outside of work that is maybe having an impact on you at the moment? And and think about, would you and I think addressing certain issues which you could align to reasonable adjustments within the workplace, that can be an easier way of discussing it, rather than saying, is this the menopause that you're in? That is just going to fall on flat ears and rise hackles up. So think about ways of helping people and supporting people through this time of this transitional time. So what do they need to know? Okay, a few basics. These basics will have been covered, I presume, a lot of times, but we'll just cover them just quickly. So every woman will go through the menopause. Menopause is the end of menstruation. It's after your last menstrual period. So it can only be, counted as menopausal once you've had those 12 continual months of no bleeding. But just that statement there, menopause is the end of menstruation. A little sensitivity around that statement, because if you're anything like me, hanging out the flags and cracking open the Prosecco, whoopee, I don't have any periods anymore. Whereas at the other extreme, some people feel almost a form of bereavement because they're not within that reproductive phase anymore, and they can feel, really bereaved about that. So a little bit of sensitivity around that, guys. So around 75% of us are going to experience symptoms, and to very, very differing degrees. Some people have extremely debilitating symptoms, and others just have a few mild symptoms. And then you've got that 25% of women who literally sail through this stage in their lives. They've got the pelvic floor intact, they've got libido intact, they have absolutely no perception of how symptoms can affect your quality of life. And that creates this complexity around the menopause, which I think, creates a complexity for healthcare professionals, as well as why it's so hard to treat lots of women, to understand if they don't communicate well. So communication is key. Symptoms are caused by declining levels of estrogen. That is commonly known, but that's alongside other contributive factors. There's other hormones bouncing around in there, fluctuating as well. You've got progesterone, you've got testosterone, you've got all your stress hormones as well, all becoming imbalanced. So it's trying to get back to that balanced natural hormonal environment for your body. But then you've got the external contributory factors as well, which play a huge role. And they play a role in not only how you cope with those symptoms, but then how you experience those symptoms. So things like your lifestyle choices, your diet, your exercise, how much alcohol you're having, how much caffeine you're having, how stressed are you, all these things play a significant role in how you're going to experience and cope with those symptoms. We'll go into that in a little bit in a minute or two. So the average age is 51 years. Different types of menopause, you can go into it naturally, spontaneously, and then there's this term iatrogenic, which covers the surgical menopause and medical menopause. So if maybe ovaries have been damaged by having to have chemotherapy, radiotherapy. And the iatrogenic menopauses are really hard, or can be really challenging to cope with. So don't underestimate how hard these periods can be for people, because it's that rapid decline of estrogen, if you've had your ovaries taken out, of your ovaries damaged, that can create this suddenness of symptoms and more intense symptoms. And it can be incredibly hard to cope with those symptoms, alongside coping with post-operative challenges and, having the fact of having to have chemotherapy and radiotherapy. So anybody experiencing these symptoms, they need to have everything explained to them prior to that surgery and treatment. Really, really important. And they need lots of physical and emotional support. So there's a proportion of the population who become prematurely menopausal. Also, called Premature Ovarian Insufficiency, and that's if you're 40 years and under. If you're in an early menopause, that's around the age of 45. Significant amount of the population, one in 100 under 40, 1 in 1,000 under 30, and 1 in 10,000 under 20. So, you know, it's, again, you need to have really good physical and emotional support when going through the premature menopause. Now, a point to point out here, which probably has been pointed out many times before, if you have, so one of the first signs of hormones starting to fluctuate can be a change in your menstrual cycle. If you have a change in your menstrual cycle, if you have, you know, if you start missing your periods for 2 or 3 months, and if you find yourself that you're in your 30s or 40s, you need to go and get that checked out. And I think one of the biggest mistakes of women is that they don't look after themselves well enough. They don't think of themselves first. They're always, if you've got children, if you've got elderly parents to look after, you know, we're always putting other people first, aren't we, instead of ourselves. If you have any changes in your menstrual cycle, if you're worried about any significant changes, go and get yourself seen. It's really important, and then you can exclude other things that might be going on. And if you do find yourself prematurely menopausal, then you can get treatment as soon as possible. But every woman should receive holistic, person-centered care. That's really important. I know I talk 10 to the dozen, so if you want to slow me down, Claire and Elizabeth, just wave your hands and say stop talking 10 to the dozen. But I know I've only got an hour, so it's really important. So a few terms. So the premenopausal, reproductive stage prior to menopause. Perimenopausal, that's when your estrogen starts to decline. I'm going to go back to the stage in a minute, and that's the most symptomatic stage of the menopause. And then you become menopausal. Now, again, this is only you can only be classed as menopausal when you've had those 12 continual months of no bleeding. And that's sometimes, for some people, that can be really hard to establish, because if you're already on hormonal medication, if you're on the contraceptive pill, or if you've got a Mirena coil and something like that, that'll be masking your symptoms. Maybe you're amenorrheic, so you haven't got any periods because of this hormonal treatment. So it can be quite tricky to establish sometimes. And I think a lot of people get absolutely desperate to know what stage they're in. And sometimes it's not possible to know what stage you're in until you come off the medication. So, you know, chatting to an experienced nurse the other day in one of the Edinburgh clinics, and she was saying, you know, I think people get so hung up about getting a diagnosis. And, you know, really, I think, you know, take a step back and think, okay, if the treatment that I'm on at the moment, if that's coping with my symptoms, and if, you know, it's helping me with the symptoms, then okay, just I'll hang my hat. I don't actually need to know, am I in that perimenopausal stage? Am I fully menopausal? As long as my symptoms are under control, then that is fine. Just a quick note about diagnosis. Unless you are in early or premature menopause, then you shouldn't be being offered the FSH test, the follicle stimulating hormone test, because your hormones are fluctuating all over the place, and it is really, really hard to get an accurate reading. If you are prematurely menopausal, then absolutely have that test done, but it needs to be done accurately. You need to have at least 2 tests done 4 to 6 weeks apart, preferably around the 3rd day of your cycle, if that can be established, to make that as accurate as possible. So many blood tests that are done which aren't done accurately, and they are a waste of time, because your hormones are fluctuating around so much. So you should be able to be diagnosed by talking about your symptoms effectively. And then you go from menopause, you go into that postmenopausal stage. But I just want to go back to this word perimenopause, because there's so much confusion. I'm talking to lots of women, there's so much confusion around this stage, even with all the information that's out there at the moment and the raised awareness. So many women think they've got to get themselves through this stage before they can go for treatment and before they can go and seek help and advice. It really doesn't, you know, they're almost on their knees trying to cope with symptoms and waiting to become menopausal before they go seek help or advice. Absolutely not. It doesn't matter what level of experience you're having with your symptoms. If you want advice or you want intervention, absolutely go in this perimenopausal stage. You know, there's also the misconception that you have to have stopped having your periods before you know, if you're wanting medication, that you can go and have hormone replacement therapy, or think about having hormone replacement therapy. Absolutely, you can have hormone replacement therapy in this perimenopausal stage. It's really, really important that people get the accurate information. But that is what your GPs and your healthcare professionals, your practice nurses, that's what they're there for. And at the moment, you know, you can contact them on the phone, you can get a video call, you know, that's their job. That's what they're there for. Seek advice from them, find out what's the best solution for you, have a conversation with them, and make sure that you find the right ways to cope with your symptoms. Really, really important. Okay, so we'll go on. How am I doing for time? I've got half an hour, right. So we'll whistle through a few symptoms. I'm not going to cover lots of symptoms because they have been covered really well before, but it's easy to split them up into categories like this, isn't it? So you've got your physical symptoms, things like your hot flushes, your night sweats, your joint aches. Hot flushes and night sweats can be accompanied by palpitations. Some people start developing migraines and headaches. Joint aches are really, really common. Different changes in your menstrual cycle, obviously. You know, fine motor skills. Anybody started dropping lots of things like that? That can be a problem as well. Feeling a little bit more clumsy. Lots of different ways to cope with those symptoms. I'm going to go on to that in a minute, so I won't do those individually at the moment. And then you've got the psychological, emotional symptoms. Now, these are some of the most underreported, undertreated symptoms, and can be some of the most debilitating symptoms. As with anything to do with mental health, it's the last thing people want to admit that they've got, but they're, you know, especially if you're in the workplace, you know, lack of concentration, low moods, loss of memory, things like that. You can, you know, you could take shares out in sticky labels, couldn't you? Some people. I mean, I know if you could see my screen now, I've got about 100 little sticky labels all the way around, and my memory is absolutely shot to pieces. But you know, it's ways of learning to cope with those symptoms, and thinking about the natural ways that you can cope. First, thinking about your lifestyle, your diet, and your exercise. Diet plays a huge role in helping with cognitive function. You know, it's well recorded. You know, Claire's done a fantastic. I looked at your video there, Claire, on that fantastic nutritional. Yep, you go. It was brilliant. So a huge connection between your gut health and your brain health. Well known now. So do remember about your diet, your exercise, releasing those endorphins, trying to naturally balance those hormones, and then think about the medication as well. Absolutely correct that there's been historic overprescribing of antidepressants. Antidepressants definitely have their place in the medical world, but there has been historic overprescribing of them, and you know, they are very, very useful, especially if people can't have hormonal treatment. Then they do play their role. You'll find that, you know, other forms of medication which aren't hormonal, they'll maybe deal with one or two different symptoms, whereas HRT deals with a whole different umbrella of symptoms. So, but think about the natural ways of helping with these symptoms. First of all, think about, you know, alternative options like cognitive behavioral therapy, which I'm going to speak a little bit more about later on. But reducing stress levels can really help with these symptoms. They can really help with the lack of concentration and poor memory and low mood. Getting those stress levels under control can really help. You've got a few long-term symptoms. So the genitourinary symptoms, they're classed as some of your long-term symptoms. Osteoporosis is another very common one. Not everybody's going to go on and develop osteoporosis. The best way to view long-term symptoms is to think of, how can I prevent those from happening? So again, go back to those lifestyle choices. Think about your diet, think about your bone health. What do your bones need? They need, you know, a good amount of protein in your diet. They need calcium, magnesium, vitamin D to process that calcium. So that's the only supplement I'd definitely recommend taking, is vitamin D to process that calcium. But again, Claire's gone into this in nutrition as well, so catch up with all the nutritional side of that. Things like exercise plays a huge role with osteoporosis. So think about how you can incorporate into your life weight-bearing exercise as well as resistant and non-resistant exercise. So weight-bearing, you don't have to start pounding the streets of the you know, clad in lycra. You can just do some things like, Pilates and yoga, absolutely ideal. That's weight-bearing. Plus also think about moving your joints through their full range of movement. You know, estrogen declining affects the lubrication around your joints as well as that bone density as well. So it's really important, you know, lubrication become more glue-like. So it's really, really, really important to release that lubrication just gently. You don't have to do anything fantastic. You know, you don't have to start signing up for Ironman or thing like that. You can just roll out of bed, do 10 minutes of high intensity exercise, or you can just do some simple stretching, just making sure you move those limbs through their full range of movement. And then you've got some rare symptoms, which actually, personally, I actually don't think they're that rare. I think, you know, they seem quite common to me. Things like burning mouth syndrome, having mouth ulcers, things like that. are not so rare. And then we get to the genitourinary symptoms. Now, these are one of my favorite symptoms to talk about, because not many people like talking about vaginas. And I think it's really, really important, because they are, like the psychological, emotional symptoms, they are some of the most underreported, undertreated symptoms out there. And they really can have a very successful rate of treatment if you actually go and get treated for them. So basically, the first thing I'd say to you is these are symptoms which have a far-reaching impact on not only yourself, but on your partners, going back to the men. So, and also what you've got to remember is your healthcare professional is not telepathic. If you're not, if you don't go to surgeries for routine checkups or anything like that, if it's quite a while since you've had a cervical smear, nobody knows what is going on with your vaginal tissue and with the urinary side of things. So it's up to you, if you're suffering from any of these symptoms, to make sure that you go and communicate that to somebody. And just remember, general practitioners and nurses, they look at bottoms day in, day out. They are not bothered about looking at your bottom. So that's the first thing to do. You can tell I'm a nurse, can't you? So it's the first thing to think. The next thing to think is know your own body. Just like, how many women do I come across and they've never had a peek? It's really, really important. Obviously, you can't look up your vagina without a speculum. So what I'm talking about, these external area, the vulva area, really have a look. Know what's normal for you. See if the tissue looks healthy. And just know, just get to know your body a bit as well. Just once a month. That's really important. But estrogen declining can really impact on this area. So it causes the tissue in this area to become thinner and less elastic. It changes the pH level, the acidity levels of your vagina. So you can become more prone to infections, things like thrushes, not the songs, not the birds, but thrush. But you can also, UTIs are very predominant in the postmenopausal years as well. And it takes sometimes quite a while for people to join up the dots and think, hang on a minute, how old is this lady who I'm treating? I'm not going to prescribe her another dose of antibiotics. Let's have a think about what else I could be doing. Maybe she needs some vaginal estrogen. So what I'd say, first of all, the ways to go about helping yourself within this area, first of all, think about things that you can do yourself. So obviously, the basics are, don't use heavily perfumed shower gels or bath oils and things like that. Make sure that you're using emollient shower gels, things like Dermal 200
different places,
or hello there, and make sure you're using things like Dermal 200, or which is really good. Now, emollients are really good because they protect and they hydrate the skin. And you might think, oh God, that's really dull and really boring, but the more dull and boring the soap substitute is, the better for your skin. Okay, in this area, it softens and moisturizes the skin, it soothes the skin, it covers it with a protective film, and it really is, and it prevents it from drying out. So really think about what you're putting on your skin as well. If you've got dry skin, if you've got vaginal irritation, dryness and soreness, what do you do for the rest of your body? If you've got dry hands, if you've got a dry face, what you do, you immediately reach for moisturizer, don't you? And use moisturizer. Again, please don't use your facial moisturizer in this area. It's very different skin, but it's a huge business out there, vaginal moisturizers, but they really do help. They really do work. Helping to moisturize, helping to lubricate in this area. It can be a really good starting point. One in particular, Silk, they don't pay me, don't worry. That's really good. It's paraben free, hormonal free. You can use it as little or often as you like. It's available on the NHS. And it doesn't interact with anything else that you might be using, but it's a matter of finding one that suits your physiology and giving it a go. But the best form of treatment is vaginal estrogen, hands down, absolutely. I mean, if you talk to anybody, like I was chatting to and interviewing Myra Robson, who's the founder of the Squeezy App, and she was saying, gosh, if it was my vote would be giving all women vaginal estrogen when the moment they reach a certain age, because it can have such an impact on the tissues in this area and really, really help with some of the symptoms. So it's localized treatment. It is a tiny, tiny, tiny amount of estrogen that you are using, and extraordinarily low systemic absorption. And you can use it also in combination with the systemic HRT. So if you're finding that you're taking HRT for your other symptoms, whether that's orally or transdermally or whichever route you're having, and it's not quite working well enough for those genitourinary symptoms, you can have that vaginal estrogen in addition to your systemic HRT. In certain cases, if you unfortunately have experienced breast cancer, if you're under the care of an oncologist, because it's such low systemic absorption, in certain cases, you might be prescribed that as well. But that's very much to have a conversation on an individual level. But very much think about going along to your GP, going and having a chat and having that conversation and deciding whether you want to give it a go. Now, vaginal estrogen, really, really two important points. If you've decided to go down the route of having it, it takes a little while to work because it's a very, very, very small amount. So it's not going to work in 2 or 3 days. You need to give it at least 2 weeks, if not for some people 3 months. Okay. And also there's different ways of having it. You could have pessaries, you could have creams, you could have a vaginal ring, which is impregnated with estrogen that gets inserted and gets changed every 3 months. So think about different options of the ways that you would maybe like to have it if you want to go down that route. And then if one route isn't working for you, you don't like it, go back and get seen, and don't just stop using it. Make sure you find one which suits you and your physiology. Make sure you're wearing natural fibers, don't wear tight clothing, all these sorts of things. And do remember that the vagina is self-cleaning. It doesn't need a spring clean. It doesn't need any douches or anything like that. So do remember that, please. It really is really important. So treat it with respect at the end of the day. Now, the urinary symptoms, just going back to pelvic floors. So urinary symptoms, yep, definitely, they get affected by declining levels of estrogen as well. But the main thing you've got to do with these is think about that pelvic floor again. And hopefully you're all doing a pelvic floor. So you'd have done 2 pelvic floors by the time I've finished this talk, which is absolutely wonderful. It's a series of muscles, the pelvic floor. And there's 2 key words. So 2 key words that you don't want to be doing. You don't want to be squeezing. You don't want to be clenching, and your face and your buttocks and your thighs don't want to be all clenched. You're probably not doing a pelvic floor if you're doing that. 2 key words are lift and squeeze. So gently lift, gently squeeze internally that pelvic floor, and try and hold it for the count of 10. If you can't hold it for the count of 10, please don't beat yourself up, because like any muscle, it needs a little bit of time to work. So if you can only get to the count of 4 within the first week, absolutely wonderful. And then work up to count of 5 the next week and move on. So very much, but please try and think about doing those pelvic floors. So I'm going to rattle on here because I want to get to CBT. So
Ruth, sorry,
yes.
Can I just interrupt while you're talking about symptoms? Just a couple of questions we've had. First of all, one woman, Rachel, says that her GP said that memory wasn't affected by menopause. What do you do when your GP just flatly says, no, this isn't menopause, and you are convinced it is? How should we talk about this with our GP?
Well, first of all, what I'd do, if they're really not up to speed with everything, I'd direct them to British Menopause Society and tell them to have a look at that website, because anybody can go on there. They can scroll along to publications, they can scroll down to tools for clinicians, and they can see really, really good summaries on anything to do with the menopause. So that's the first protocol. Make sure that if they don't want to go onto the BMS website, but that is probably the best website for them, then they can also read up the NICE guidelines as well, diagnosis and management of menopause, which in black and white for everybody to see that, poor memory is definitely a side effect of estrogen declining.
Cool. And Jackie has a question, if you wouldn't mind. It's just a couple of women have asked this just now, so I thought it would be a good time to get it before we move on. Jackie, are you around?
Yeah. I'm here. I am. I'm in Cricklewood, northwest London.
Hello.
I just wanted to ask a question about going to the loo. So I'm finding it quite difficult sometimes now to completely feel like I've emptied my bladder.
Yes.
And I don't know if that's something to do with some other issue, or is it an aging thing, or it's a menopause thing. So just wondered what your thoughts were on that.
that can be a side effect, but I would always get something like that checked out with somebody who is a specialist in that area. Get yourself referred to a physiotherapist who specialises in women's health. That's what I would do personally. Make sure that you do your pelvic floors, Jackie. Do download that Squeezy app, but get yourself referred to somebody, to a physiotherapist who specialises in that area. Yeah.
Okay. Thank you.
Right, but that is a common side effect as well.
That's brilliant. Thanks, Ruth.
That's all right. Okay, so ways to manage symptoms, various ways to manage symptoms. So the first one is naturally. Now, you've covered lifestyle choices, diet and exercise. You've had some wonderful exercise gurus on, so I'm not going to go into that. It's a no-brainer to do a exercise, weight bearing, non-weight bearing, resistance exercise. You do not have to, do anything amazing. You don't have to run, you don't have to cycle. You could dance around the kitchen every night. You could do some Pilates. Just as long as you're moving and you're raising your heartbeat and you're putting your joints through their full range of movement. That is one of the most important things. Lifestyle choices, looking at that diet. You've had some fantastic nutritionists on, and so I'm not going to go into that, but making sure that you have a really nutritious, balanced diet really plays a huge role in how not only experience symptoms, how you can cope with symptoms. Really does have an impact. Making sure you're really well hydrated. Really look at those alcohol levels. Not more than 2 or 3 units of alcohol a day. Not, no more than 14 units a week. I'm not going to tell anybody to become teetotal. At the moment, I'm going through a dry January. I've got till Sunday to go. Wonderful. I love a gin and tonic, so I'm looking forward to Sunday night. Absolutely wonderful. But guess what? I have slept like a baby because I have not had alcohol for the whole of January, and definitely helps some of the symptoms. Absolutely. So really do look at your alcohol levels. Go on the Drink Aware website. It's quite interesting if you pop in how much alcohol you drink, honestly, if you're honest. But it does impact on your symptoms massively, especially with sleep, with hot flushes, night sweats, all these sort of things with your joint aches. The same goes for caffeine. It can take some of us 8 to 12 hours to process 1 cup of coffee. So if you multiply that, and the impact multiplies, doesn't it? Obviously, if you have multiple cups of coffee. So if you really can't do without that double espresso, have it first thing in the morning, and make sure then you don't have any more caffeine throughout the day. And always stay, if you're having cups of coffee and you're having alcohol, always have that glass of water at the same time to make sure you're well hydrated as you go along. Can always help. So alternative remedies, we'll just briefly mention these. So herbs and supplements. Err on the side of caution. Always make sure that you see somebody who really knows what they're talking about. The last thing you want to do is dash into your local Holland & Barrett or wherever it is, grab 3 or 4 pots off the counter, and then randomly start taking tablets. You won't know which one's working, and they might all be interacting with each other. So all these things have side effects. That's the most important thing. Make sure you get a good quality one. Make sure you read the label to see what's in the back of them. Some of them have packers and fillers in, but please try and see either a medical herbalist or a phytotherapist or something like that, so that they can definitely recommend the right ones for you. Maybe they might give you a tincture, maybe might give you a variety of tablets to take, but they will know what's going to interact with other medication that you might be on, which is really important. There's non-hormonal medication that you can have. Some people don't either want to go down the hormonal route, or they can't, unfortunately, if they've had estrogen receptive cancers. So there are other forms of medication, so things like your antidepressants, things like clonidine, things like that, that can help with certain symptoms. And then you've got alternative options. We're going to go into one of those in a minute. Things like cognitive behavioral therapy, lots of wonderful other options to look into, which unfortunately quite a lot of us don't have access to at the moment, because things like acupuncture, aromatherapy, things like reflexology, massage, all these wonderful things. But there's no way that you can't just start sort of trying to do things for yourself. The really good aromatherapy oils for hormone balance are geranium oil and lavender oil and chamomile oil. There's nothing to stop you getting a nice bath oil and using those. And if you don't like baths, then pop some oils onto a shower and let the steam in the shower do its work. And also, again, don't forget things like magnesium flakes. If you can't get enough magnesium in your diet, think about having magnesium flakes in a bath. If you don't like baths, put them in a foot bath. if you've got really sore finger joints, if you're a touch typist, or you do a lot of sewing, something like that, you're getting clumsy fingers and your joints are seizing up. A little bit of TLC, look after yourselves, and put your hands in warm water with some magnesium flakes in, and take that magnesium in transdermally. That's always a really good option. And then you've got hormone replacement therapy, huge topic to tackle, which I just don't have time to do, but is definitely a valid option for the majority of women. The first thing, and the only thing really I want to say about HRT is, please, if you want to read up about HRT, please don't read newspapers, please don't read any forums, please don't read journals written by celebrities, please read documents and articles which are written by clinicians who really know what they're talking about, who deal with this day in, day out. Look at the date of the document as well, because research evolves, research changes. So really important, look at the date, look at who's written it, and know what you're reading. And one of the best websites to go to is the Women's Health Concern. It's the patient arm of the British Menopause Society. Got fantastic fact sheets on anything to do with HRT, and that should answer all your questions. And if not, then go and seek advice from people who really know what they're talking about. And just remember that your prescription is only as good as your prescriber. So if you're not happy with the person who's prescribing them, find somebody who you are happy with. There's British Menopause Society. You can punch in your postcode and find your nearest menopause specialist. Menopause specialists are few and far between. They're there for the more complex cases of menopause, and they're there for your GPs to refer to. But if you're not getting any luck, then that is an option that you maybe could think about getting referred to one of them. But basically, there are 50 different combinations of HRT out there, so there should be an option available for everybody. Different ways of having it: transdermally, orally, subcutaneously, vaginally, whole different way of having them. It's a matter of finding one that you are happy with. Okay, so I'm going to move on, because I can go on and on about HRT, but I won't. So what I'm going to do is go and move on into CBT. So cognitive behavioral therapy. And I think with CBT, first of all, I want to say that you put therapy after a word, and that immediately turns a whole load of people off. And I think just think of it as a really, really good alternative option. It can help you develop a range of coping strategies, which can help you, things that you struggle with in everyday life. It helps you to manage problems by changing the way you think and behave. There's a misconception that CBT is all about thinking positively. No, there's lots of different things to CBT. It's very much a talking therapy. It's very much dealing with current problems and thinking about practical tools that you can use. And it's not really suitable for some maybe more complex psychological conditions. But I think, just get rid of that, the stigma about the word therapy is a good one to start with. I think if you put therapy after something, it's immediately people think that you're telling them that there's something psychologically wrong with them, which obviously it's not. It's due to your estrogen declining. So CBT is really, really helpful in helping with things like anxiety and stress. Excuse me a minute, I'm just going to take a glass of water. Anxiety and stress are really helpful with sleep. If you reduce stress and anxiety levels, then that can really help to manage your hot flushes and night sweats. There's an enormous amount of research done by two ladies. I'm going to recommend the book, which is a self-help guide. They've written, a Professor Myra Hunter and a Dr. Melanie Smith. Absolutely fantastic self-help guide that they've written. I'll put that up at the end, so don't worry about writing that down. But CBT can really help as well. If you unfortunately, if you suffer from breast cancer, the side effects of medication of that can be really debilitating. So it's a really good option to consider as well. So why use CBT? Well, it's a non-medical option. That's brilliant, because it's not going to interact with other things that you're either taking or using. Tools and skills that you learn, they're beneficial throughout life. So not just through this transitional period. And you will find that if you start using certain tools, then your partners and husbands might suddenly think, gosh, she's managing to reduce her stress levels, and I'm going to copy her. That's absolutely fantastic. So by helping, it helps to reduce the intensity and frequency of menopausal symptoms, things like hot flushes and night sweats, by reducing the stress levels. So it's the stress, it's being able to reduce those stress levels, which really has an impact on how you experience those menopausal symptoms. And so it helps you to learn to react to stress and everyday pressures in a different way. So therefore it helps to improve overall health and well-being. I do realize I'm zipping through this, but I'm just aware of time. I do apologize. So advantages of CBT, it's non-invasive, hurrah. It's not going to interact with anything, which is wonderful. Absolutely anybody can learn simple CBT tools. And I think that's another important thing to say. It's really hard sometimes to access CBT therapists. You know, the ideal, if you're suffering from menopausal symptoms, is maybe to consider doing a group CBT therapy session, but that can be really, obviously it's very tricky whilst we're going through this pandemic as well. So learning some simple CBT tools yourself is absolutely within everybody's reach and can be attainable. And of course it can be utilised alongside other treatments without fear of interaction. It combines well with things like that you're doing already with, you know, in your lifestyle, thinking about your diet, your exercise, because it's not going to interact with it. It's just a good additional factor to take in. And I think that's an important point, is when you're thinking about coping with menopausal symptoms, you don't just want to go down one route. You want to think of lots of different things that you can do. So the same with your diet, how many different bits of nutrition can I add into that diet? The same with other things. How many little things can I add into my lifestyle, my diet, my exercise? Can I think about doing some CBT? So ultimately, though, what you're wanting to do is give people a sense of control back. So that, for some menopausal women, is the ultimate problem, is that they just don't feel themselves. They just don't feel a sense of control. And if you can give even a nudge of that back, that can be really, really helpful and reassuring. So you want to develop these self-management skills. So I've been yabbering on away about tools and how to cope, and so one very simple tool to think about is the breathing tool. So by that I mean everybody's probably heard about diaphragmatic breathing, and if you're a yogi then it's called belly breathing, and I think a lot of people discount this and they go, oh my God, somebody else talking about flipping breathing. I'm tired of people talking about mindfulness and breathing and does it really work? You know, slowing your breath down physiologically really does help to calm your body down. It helps to reduce stress levels. You know, there's been lots and lots of research going into this. It really, really does work. I'm going to just turn on my video here again. I'm going to get my ugly mug on. Hang on a minute. There I am. So hello, everybody. Because it's so important to really take this tool of CBT seriously, because it really can help to reduce stress levels. But it's a matter of practicing it, and so that it becomes second nature. So you don't have to, you know, always used to be, oh, practice your diaphragmatic breathing, lying flat on your bed, lying flat on the floor. Nope, you can do it. It's like your pelvic floors. You can do it anywhere, anytime, any place. So the important thing to do, though, is to focus on how you're taking that breath in. So it's a really simple diagram, explains it really well. So you're inhaling through your nose if you possibly can. And you are, when you inhale your breath, instead of your chest going up and down, you're wanting your belly to go out. Okay, so if somebody, the extreme of somebody being really, really stressed, almost having a panic attack, the chest is going up and down, isn't it? Very, very shallow breathing. They're not getting enough oxygen in. So what you're wanting to do is the opposite of that. So you're wanting to really relax those shoulders, making sure you can do it anywhere. You can stay standing in the Tesco queue with 3 kids around you, fighting their way and thinking, I'm not going to let this hot flush get the better of me. I'm going to breathe my way through this hot flush. There are no magic cures for menopausal symptoms. Sometimes HRT can feel like a magic cure, but there are no magic cures, but you can help reduce those intensity and frequency of symptoms really well. So best way to practice it, do this, is that, you know, you put one hand on your chest, one hand on your tummy, And that's one way. So when you take a breath in, some people count for 4, some people don't count, but your inward breath is as important as your outward breath. So when you take a breath in, you want to be making sure that your tummy is blowing out rather than your chest going up and down. So when you take a breath in, you can see my tummy actually, can you? And then let the breath out, okay? Another way of doing it is to put your fingertips together over your tummy, and when you take a breath in, you want those fingertips to separate. So, you know, you can do it slouched on the sofa there if you're sitting on the sofa. When you take a breath in and your tummy wants to be blowing out and your fingertips separating, and when you exhale, your fingertips are going back together. Sounds really, really simple, but it sometimes takes a little bit of focus, especially if you're really, really stressed and anxious about something. So if you're doing, I don't know, your Zoom call for loads of people, which I do every day, so I don't get stressed about that. But say if it does stress you out and you're thinking, gosh, I can't cope with this, how am I going to cope with that? So just think about those simple breathing movements that you can do, and if you practice it, it becomes second nature. So, you know, if you feel, say, like you feel a hot flush coming on, you're not going to stop that hot flush, but you can reduce the intensity and frequency of it. Again, if you're having a night sweat in the middle of the night, don't get yourself in a paddy about it. Just think, okay, what was Ruth yabbering on about? Right, okay, I'm going to breathe my way through this night sweat. Okay, I know I'm going to get a bit hot and sweaty, but I'm not going to rise to that, and I'm just going to breathe my way through it. And the more you practice it, the more effective it is. So if you can reduce those the levels of those stress hormones that are getting exacerbated, you know, and making everything, no, not getting exacerbated, if you can reduce the levels of stress hormones which are exacerbating your menopausal symptoms, then that is a big plus, isn't it? So it's a very, very simple thing to do, but really important. Well, I'll just turn my phone, there we go. Right, okay. So the aim is, I'm nearly finished, ladies, don't worry. The aim is peace of mind, a sense of control, a bit of self-management, and improving your health and well-being. So eventually a better quality of life. But the other way of, you know, as I said at the start of talking about CBT, is misconception. It's all about positive thinking. It's very much changing the way you think about things. So in everyday life, so if you say, take hot flushes, for example, if you get really stressed having a hot flush, some people a hot flush is a warm glow. For other people, you're literally dripping with sweat, aren't you, within 2 or 3 minutes, looking like you come off a squash court. So if that's the case, you have a negative view of a hot flush coming on, stress increases, and that exacerbates that hot flush. So what you're wanting to do is breathe your way through that hot flush, reduce the intensity of it, and you'll have a better experience. So these are the 2 books that I definitely recommend. This one here, Managing Hot Flushes and Night Sweats by Mara Hunter and Melanie Smith. Very modest. That should be Professor Mara Hunter and Dr. Melanie Smith. Really, really experienced clinical psychologists. And I can't recommend that book enough. It's really, really good self-help guide. They're just about to publish this book, Living Well. I'm dying to read this. But this is like a light bulb coming on for some people. If you are interested in this, it really does. It really will help. And then there's my book there as well, if you fancied thinking a little bit more about the men in your life. There we go. Just a few more useful resources. Women's Health Concern, you've got all those fantastic fact sheets. Menopause Matters, British Menopause Society, really good for those GPs who aren't up to speed. Your nice guidelines. My website doesn't replicate any of these websites up here. It's just a nice chatty blog, but puts things in maybe an more easy to read format. Please, everybody, download the Squeezy app. The Daisy Network is fantastic for anybody experiencing premature menopause. The Eve Appeal, another fantastic charity for anybody experiencing one of the 5 gynae cancers. And then you've got Endometriosis UK.
That was brilliant. I've done CBT in the past, and I've never really thought about doing it for menopause, but it is true. Like when I used to be having a panic attack, CBT training could really, really help to reduce it down. It's cool. With CBT though, is there anything online where people can access tools to help them? Because if you go to your GP and ask for CBT, you're looking at about a 4 to 6 month waiting list. You are, which is why. How can women get this?
It's so hard, which is why I recommended that book, because honestly, I found that is the best resource definitely. It's not a big book. Look, it's a very slim book. It's a really good self-help guide. So I found that is definitely the best resource. These women, they have done extraordinary amounts of research, and they continue to do it. So they have definitely proven that CBT really helps to reduce the intensity and frequency of hot flushes because you're reducing those stress levels. And so, you know, they go into all different side effects of different symptoms as well, how it can help other symptoms, things like your sleep patterns really helps with those, alongside exercise, diet, and all the other natural lifestyle choices you want to take. So that honestly is the best resource, I would say.
Cool.
Get it on any outlet, Amazon, Rutledge, whatever.
Yeah. It's on my list. It's going to get done. And for everybody who's been watching, the list of resources that we'll put up at the end, we'll add them onto the end of, well, they'll be on the end of the YouTube video anyway, but we'll add them in with the links as well, so you can access them quite easily, because there were some really, really interesting links on there and some good links to help. And we're just getting loads and loads of thank yous and people saying how interesting they found it. I know I certainly did. The CBT having a bit of a dodgy HRT time at the moment, so I think I'll be getting back with my CBT training and putting that into practice, definitely, to try and help some of the symptoms. But yeah, on behalf of everybody, thank you so much, Ruth. That was, I've really enjoyed it. I've been making notes.
Oh, I'm really sorry I'm into overtime and I've not left enough time, but I'm quite happy to stay on if anybody wants to ask any questions, but I'm really, really sorry. I did jabber on for a little bit too long.
Oh, it's cool.
All my failings.
Oh, thank you. Like I said, everybody on the chat is just saying thank you so much. They've really enjoyed it. So thank you.
Well, thank you very much for having me on. It's really kind of you to have me on, and good luck, everybody. And you know, just find your own solution. You know, make sure you know all the different options. Have the conversation with the right people. That's the important thing, I think.
Brilliant. And as we said, this will be going up on our YouTube channel, which is Pausitivity. And there's all our other talks on there. There were some questions coming up which we've covered in previous episodes, so have a look through. There's some really, I'm not blowing our own trumpets, but there are some really good talks on there. It's very good. And that's it. We have our next Positive Live on the last Thursday in February, which is the 25th. Be chatting to, I can't remember Harriet's surname, but it's Harriet, who has written the Menopause monologue books or collated lots of different stories. So she's going to be talking about how she brought them all together, why she's so interested in them, and the reaction she's had. So I'm really looking forward to that, because those books are great. They're really helpful. Yeah.
And then on though Liz won't actually tell you this, but the March Positive Living is going to be Elizabeth herself.
Ooh,
I know, talking about progesterone deficiency, which is so interesting, and every woman should really understand this, the causes and the symptoms that can occur, because there's lots of light bulb moments that can occur from that. In April, we have a fabulous lady who is a divorce coach. That sounds really good, but she is actually a life coach. She deals mostly with midlife women. It's amazing how many midlife women get on the divorce pathway, whether they instigate it or the male instigates it. But yeah, she has an awful lot of really important stuff that she can share with us to help us keep our relationships together. I know you touched on that as well, Ruth, there. She just expands on that. And then in May, we just have a confirmation that we've got Dr. Claire Mccauley, who was introduced to us by Ruth, actually. She's
everybody.
She's an oncologist and a sex guru. She's going to be talking to us about all things sex related. Again, it ties in so beautifully with Danielle talking, the divorce coach talking to us, and also with what Ruth's talked to us tonight. So it seems to be a bit of a trend this year. But yeah, so, you know, we look forward to meeting you all again sometime in the future. It's always the last Thursday of the month.
And that's it. just a huge thank you to everybody who attended. We love seeing familiar faces again. Share the word, and we hope to see you next month.
Yep. Thank you all.
Okay.
Bye.
Thanks
Bye.
so much. Bye. Bye-bye.